Thank you. Mr. Musi.
I'd like to let the Assembly and public know that staff team has been working very hard on a coronavirus issue for the past 2 weeks. We are working very much to be prepared to serve the public and also prepared internally for our operation. Today we did a tabletop exercise scenario to go through the drills so we can be prepared. We practice very often to do so. Plus, too, we had some real-life incidents with a recent flood, some fires, earthquakes. So your team is very well prepared to speak about the coronavirus and issues. We have Tracey Loscar from DES who has a presentation tonight on this issue. Tracey Loscar. I slurred my T.
It's okay. Even my family does it, so not to worry. Good evening, Mayor, Assembly. They asked me to speak on the coronavirus. To give you guys some background, I have an informational brief that I wrote for Director Barkley, so I'm going to read from that and factor in what we're doing here in the borough. No pun intended or intended. I am sick to death of the coronavirus. Okay. Right? Already. I have no voice. This is me talking to the medical director all day on what we're going to do when it finally shows up. It will show up. It will. Seattle's our hub. It will show up at some point. The question is what do we do in response to it? It's a little bit more contagious than the flu, but it can be milder in symptoms, and I'm going to go through it right now if you haven't followed it, because this is kind of my thing. All right, on December 31st, 2019, the World Health Organization was informed of an outbreak of pneumonia of unknown cause in Wuhan City, Hubei Province, China. It's the 7th largest city in China with 11 million residents. The outbreak was declared a public health emergency of international concern in January of 2020. The first case in the US was January 30th, 2020. The virus has been named SARS-CoV-2, which should give you a first clue if you remember SARS from a few years ago, and is referred to as COVID-19 for no other reason than it was discovered in 2019 and COVID was considered easy to remember. It is a beta coronavirus. There are 7 types known to infect humans. It is the same family as SARS. It is the same family as MERS. The animal reservoir that it probably came from, it's called a zoonotic virus, which means it started in an animal, somebody ate the animal, it jumped species, okay? SARS, MERS, and now COVID, the likely reservoir is bats, so don't eat bats. All right, much is unknown about how it spreads. Current knowledge is based on what we know about other coronaviruses. It's called a coronavirus because it looks like a little crown. It tends to be fragile, it's easily killed, but it can stick around on hard surfaces for 2 to 9 days. They're not sure, but it is easily cleaned and it's easily killed. Most often spread from person to person, happens among close contacts within 6 feet, and we'll come back to that. Person to person is thought to occur via respiratory droplets through an infected person who coughs or sneezes, much like influenza. We're talking a little bitty organism that comes around in big droplets. Okay, so just think about it that way. And typically, these droplets land in the mouth or nose or nearby and held into the lungs and cause a lower respiratory infection. It's really important to enforce. We want to keep people calm. 80% of the cases are mild. To, these people may not even enter the healthcare system, which is also a problem because it means they're not being measured, which means the numbers may be off a little bit. Similar to flu, the development of lower respiratory illness in vulnerable populations such as infants, the elderly, and immunocompromised can result in severe symptoms and the development of fatal complications. And I'll give you some numbers in a second. COVID-19 has a higher complication and mortality rate associated with patient age. Unlike the flu, which hits children really, really hard, it seems COVID-19 goes the other way. The older you are, the worse your chances are. The highest rate of mortality is in men over 70 who smoke. So, what's a risk factor? Recent travel history. It used to be from China. It's not anymore. It's from the most affected geographic areas. And right now, those areas are considered China, Iran, Italy, Japan, and South Korea. They have the highest risk factor for exposure, and CDC recommends travelers avoid all non-essential travel to and from those regions. So while the Mat Valley doesn't typically, excuse me, may not be a destination to or from China, we have a huge Asian population Fairbanks gets a lot of Asian tourism, and of course we have Ted Stevens International Airport just an hour away. So what are we looking for? Fever plus recent travel history. They've updated the matrix for us to clinically suspect someone of having COVID-19. They got rid of China and put all the other affected areas. When I go into the symptoms, you'll see what the problem is. So the overall case fatality rate is between 2 and 4%. Okay, again, in the elderly, it's 80% of mortality cases are in patients over 60 years of age. All right, if you wanted to compare it to the other big ones, SARS has a fatality rate of 9%, okay? MERS has a 34% mortality rate. COVID-19 is sitting at 3.3%. Now they say, okay, the flu is worse, but we're talking a game of numbers. Influenza only has a current case fatality rate of 0.06%. It's a case of numbers. It's more contagious and it's hitting people pretty hard. What are the numbers as of 5 p.m. today? There are still no confirmed cases in Alaska as of 5 p.m. There are, however, 93,000 cases worldwide. The vast majority are in China. US cases almost doubled today. We're at 122. We have 9 deaths. 8 of them are in King County. 1 is in Snohomish. The 8 in King County are all from the same nursing home. Okay, again, really vulnerable population. It is present now. As of today, Wake County, North Carolina, and Rhode Island claimed their first case. So it's in 12 states nationally. We've been able to test for the virus since last Thursday. Every state was issued a finite number of tests. As they make more, we'll get more. Your question about the testing for the kits, the reason they go to Anchorage or Fairbanks is because that's where the state pathology labs are. They're the ones equipped. MatSu Regional is not equipped to utilize the kit, and I don't remember the name of the machine, I'm sorry. But those machines are present in both Anchorage and Fairbanks. So the plan is, if they recognize a PUI, person under investigation, they'll take the sample, curry it to Anchorage. The test takes about 4 hours, and they said they'll make a notification within 1 hour of a positive result, 1 hour of getting the results back. That's their plan. And like they said, the test is not a cure. It does not change treatment. There is no vaccine. There is no treatment. It's supportive care only. So just to be aware of that. Flu shots is not going to affect COVID-19. What flu shots will do is reduce symptoms of flu and hopefully reduce hospitalizations of flu. The complication for COVID-19 that we anticipate is being a state of finite resources. We're going to run out of room. It's going to cause a surge. Every year in February, March, we have a surge, and it happens because of flu, right? If we have flu plus COVID-19, which is more contagious to worry about, you're talking about crowded ERs, limited access to healthcare, slowdowns, delays, and for healthcare workers who are exposed, 14 days of self-quarantine could really limit access to all of those things. We're seeing that now. The first community case in California at UC Davis, there are 124 people being monitored right now. Kirkland, where the nursing home is, 50 are in self-quarantine for 2 weeks. So that's where the concern is what it's going to do in these 2-week blocks for our available resources. Let's see. To compare it to flu season runs from October 1st to May 1st. This year's flu season, we have 29 million cases, 280,000 hospitalizations, 16,000 flu-related deaths. We have 9 from COVID-19. Okay. All right, incubation period, 2 to 14 days. Average is 5 to 6. Most common symptoms, fever is number 1. They've lowered the bar for fever at 100.0. Okay, that's what they consider a fever. Dry cough in 76 to 82%, and shortness of breath. That's what they're listing as the symptoms of COVID-19. What else does that sound like? Everything, right? Everything. It's going to be really difficult to screen for these patients. Okay, oh, they might also have muscle pain and fatigue. Okay, so what can we do for prevention? Honestly, standard precautions are absolutely 100% our best bet. Social distancing, you might want to withhold some travel. You might want to watch the large gatherings of people in close contact. You don't want to go visit your friends in the nursing home or in other places. At some point, if we do have a local outbreak, those are things we might want to consider, either postponing or delaying large gatherings of people. Social distancing is defined as 6 feet. So I don't know how we're going to accomplish that. If you're a hugger, stop. If you use a keyboard, if you use a mouse, if you use a cell phone, if you use a doorknob, you should probably wipe some of those things down. Okay? It can stick around for 2 to 9 days. It's very easy to catch. And basically, it's coming from hands to mouth and nose. Wash hands often with soap and water, 20 to 30 seconds. Sounds longer than it is for most kids. If soap and water are not available, use an alcohol-based hand sanitizer with at least 60% alcohol, and avoid touching your eyes, nose, and mouth with unwashed hands. That's pretty much it. The questions of masks come up frequently. We need the masks for the healthcare workers, and when you're talking about masks, you're talking about 2 different types. One, the regular over-the-counter surgical masks you see every day, or the N95 respirators. Again, think finite resources and supplies. You shouldn't be wearing an N95 off the counter for general everyday use. It requires fit testing. It can make people with respiratory problems feel ill. It can result in claustrophobia. For the surgical masks, it's recommended not for general everyday use, but if you have someone at home who's sick, it's okay to wear a mask. If you're going to be around someone who's coughing and sneezing all day, again, we're looking to avoid droplets. You don't want them coughing or breathing into your face. For us at Mat-Su Borough, again, I met with the medical director all day. We're working with the hospital. What are we going to do to screen these patients? They shouldn't be in advanced health care if they have mild symptoms and a fever, and they're highly contagious. So we're working on coming up with an alternate destination within the hospital, screening them outside, having a process for nurses in full PPE to do appropriate triage, and either return them home or send them for the appropriate level of care. For us, we have a pretty good culture already. We are going to be adding gowns, which we don't typically do, again, to reduce the droplets on our uniforms. And this changes every day. I am online listening to the WHO, CDC, everything else, starting at 6 o'clock every morning. Again, I'm sick of coronavirus. But it is a matter of when. It will be here. If it's not already, there are people reporting flu-like symptoms all the time. It's just a matter of what our response is going to be once it rolls through. That's what I have. Any questions?
Mr. Mayfield and Mr. Sumner.
Thank you, Mr. Mayor. Ms. Loscar, through the mayor. So could you run me through a scenario where EMS is called out to address a potential coronavirus victim, and how you would respond to that, what would happen with the patient, where would the testing be done, et cetera, how that whole process would happen?
Sure. First of all, it's going to be difficult to screen by phone. MatCom does have the updated questioning, what they call PSAP scripts, to ask questions for travel history. Again, we go on cough, cold, flu all the time. All we're adding is questions for travel history. If we have a patient with a respiratory complaint, the crew is, if they think it's a PUI for COVID-19, they're going to notify the crew in advance, preferably via telephone, because we have a lot of people that monitor our frequency and we're trying to keep everybody calm. They're going to notify them by phone that it's a potential COVID-19. If not, if it's a respiratory case, they're going to treat it the same way. They start at the door, they do a visual assessment. If they see the patient has respiratory complaints, they're going to have their eye protection and their N95s on. They'll hand a mask to the patient if he or she is able to comply, and that they'll see the patient with a mask on. We can still administer oxygen in and around a mask, so it doesn't compromise their breathing. They'll transport the patient into the ambulance. We try to create a negative pressure gradient by putting on the exhaust fan. There are things we can do within the ambulance to try to do negative pressure. And then we'll transport them to the hospital. The hospital will be notified in advance. They do have a negative pressure room in the ER. We do not enter the ER until we've consulted with the hospital. They'll come out and do their own screening, and then from then it's on them to get them into room 10 until we have this alternate destination set up. MatSu. We don't send resources to Anchorage very often because we don't have that many. If we were to send an ambulance to Anchorage routinely, we lose them for 2 to 3 hours at a time. So we can also work with LifeMed to do that kind of handoff.
Mr. Sumner?
Through the mayor, do we have adequate protective gear for our EMS employees?
It's a good question. We do.
Okay.
Right now we do. We have a decent stock. We're at par level on all our ambulances. We're at par level in all our stations. And we do have an adequate supply for right now. It's getting more. That may be a chore. And emergency management also has a reserve should we get to that point.
And then are we set up to assist Health and Human Services in contact tracing, or how would that work?
So their Office of Epidemiology is the one taking the reports. They're all mandatory reporting to DHSS, and it would work backwards. All the responders would be notified. And then from then it's on them to do the trace contacts prior to our involvement with them.
Mr. Mayfield and Mr. Musi.
Just to follow up through the mayor. So the scenario you gave us earlier, would that patient remain in the MatSu, or would they be transported to Anchorage? How would, you know?
That's going to be a question for the hospital, because you're talking about a really wide range of symptoms. If they're mild and they don't require advanced care and they've confirmed it, there's DHS, there's health department level quarantine. They could be returned to their home with daily monitoring by the health department. If they're advanced, and MatSu is already working on alternate arrangements, like having more negative pressure and isolation beds available to us. But I have to assume if it was beyond capacity, they'd be transferred by ground to Anchorage, would be my guess, without having someone from the hospital here to ask.
Okay. So you do have the testing kits here in the MatSu?
No.
You do not?
No. They're in Anchorage and Fairbanks. So we would notify DHSS that we have a PUI. We could draw the sample. We don't have the machine that accommodates the test. They would take it by courier to Anchorage. That would run the test and then give us the results.
Okay, so a sample would be sent to Anchorage
Absolutely.
for testing?
Yep.
All right. Thank you very much.
Of course.
A person of interest is, that's the temperature of 100 degrees, and then the other side,
So yeah, let me give you the matrix. Yeah, it's PUI, person under investigation. So we're going to start with fever, because it always starts with fever. It's fever or signs and symptoms of lower respiratory illness, cough and shortness of breath, and someone who's had confirmed contact with a COVID-19 patient, or history of travel from one of the affected geographic areas, or they're severely ill with a lower respiratory infection with no other signs of exposure. So if they've tested them for pneumonia, if they've tested them for a few other things and they don't have that, they're going to call it COVID-19 until they can get a test result back.
okay, so you have to have significant contact or be from travel to a country. That's going to trigger.
Yeah, it's close contact. And the CDC defines close contact as within 6 feet, generally for a prolonged period of time without PPE.
So right now we're hearing reports that a lot of things to prevent, like masks, like the hand sanitizer, those type of things, there's a run on those.
There is.
Not widely available in some cases. Also hearing that people are stocking up on food supplies. So the question I have, and maybe this goes back to Mr. Smolden, is the state working? Because there's times where we go to the grocery store and the ship hasn't come in yet, there's nothing on the shelves. Is there any discussion or plan if there is a run on food for this type of thing? Do we have a plan other than let the market eventually show up?
I know Kroger was supposed to be putting restrictions on how many hand sanitizers one person could buy. And I know the preparedness recommendation for self-quarantine, you're going to have to be in the house for 14 days. That's their recommendation. So you need 14 days supply of medication and food.
I'll check on that for you, Manager Musi, and get back to you tomorrow.
Thank you. I'm going to the grocery store tonight, by the way.
bread and milk, bread and milk. So.
Mr. Sumner? You okay? Ms. Nowers?
I already bought it all out today, sorry.
Right.
No hand sanitizer left.
Darn.
One question I hadn't seen sort of directly answered on the Mat-Su Borough website which has really good links for the coronavirus. It's just what you were talking about, like, kind of, should I worry, should I get tested? Should I ask to be tested? And like the kind of list of things that you had, I just, we'll leave it to you to decide if that seems like worth adding to the website on the MatSu page.
Should you get tested? Yeah, we're not gonna recommend that people get tested routinely unless they're significantly ill. Like I said, 80% of these are gonna be cough, cold, sniffle kind of things. A lot of these people aren't even gonna hit the healthcare system. They're gonna, you know, it's the problem, people going to work sick. I just have a cold, I'm gonna go to the grocery store. I mean, that's where the spread is coming from. But to report to a healthcare facility and say, you know, I have a fever, I wanna be tested. Again, finite resources, and it's not like they're not making more tests, but it's going to take time to get to Alaska.
Mr. Sumner?
Yeah,
Oh, can I just do a quick follow-up on that?
Oh, okay.
Sorry, through the mayor. I wasn't suggesting that the borough say people get tested, but maybe on the website as far as information for the public to kind of calm that, you know, that you don't get people.
Like an FAQ thing or something like that. Sure.
Yeah.
Excellent.
Now, Mr. Sumner.
Yeah, I mean, my understanding is that if you have a test and you have a population in which the disease is a very low occurrence, even if the test has a low false negative, if you just start testing everybody, you're probably going to get more people with false negatives than you're actually going to get true positives.
I can't speak to the COVID-19 test because they don't know enough about the virus. For example, we have people who are fully recovered who are still testing positive and are still shedding what they can call shedding viruses. I'm not smart enough on that to say population-based, you know, how many tests. I just know there's a finite number of tests out there.
Assemblywoman Bovee, did you want to jump in?
Thank you, Mr. Mayor. So in a previous life, I was a director of nursing for a 12-story facility, so I have some appreciation for the challenges you're facing. I just want to commend your professionalism and your proactive response to this. I appreciate that. Thank you.
Thank you. We're trying to stay ahead of it. Manager Moosey's been really supportive. We are, and Dr. Zink said it in the press conference yesterday, they have been actively working this for at least 5 to 6 weeks, so we are well ahead of the curve. We're not going to have to backpedal. We kind of know in advance what we're going to have to deal with.
Okay, thank you very much for a great report. We appreciate that.
Of course.
For updating us. Mr. Moosey, anything else?
Yes, I have.